With digital health rights discussed at the 78th World Health Assembly in Geneva, Switzerland, how effective do you believe these digital tools and games are in advancing reproductive health education and outcomes?
Yeah, so I was a co-PI on a study that was focused on a digital app called the Dot app. And the Dot app, D-O-T, the Dot app was focused on, it was what they call a fertility tracker. That digital tool was interesting because it opened my eyes to like how people are interacting with their health and technology.
Now, how has your research contributed to shaping healthcare guidelines on vasectomy? Additionally, according to you, what are some of the most common misconceptions about the procedure that should be addressed during patient counseling?
Vasectomy provides an on-ramp for men to get into the health system, and even reproductive health. Just like women's reproductive health is the way in which the doctor can engage with them on a continuous basis, reproductive health can also be a way to pull men into the health system.
Dr. Dominick Shattuck is a research associate faculty at the Johns Hopkins School of Medicine and an affiliate faculty of the Department of International Health at the Bloomberg School of Public Health. Dr. Shattuck also leads Relational Ground, a private organization that provides research and project management services. He is a community psychologist specializing in global public health, focusing on reproductive health, COVID-19, masculinities, and men's health. He contributes to the Breakthrough Action Program at the Johns Hopkins Center for Communication Programs, where his work highlights the dynamic relationship between individuals and their communities. His notable contributions include leading the first randomized trial on male engagement in reproductive health, supporting the national integration of vasectomy services into district hospitals in Rwanda, conducting the first prospective cohort study on the use of a fertility tracking app for pregnancy prevention, and developing the first series of mobile games centered on reproductive health. Dr. Shattuck contributed to the development of the COVID-19 Trends and Impact Survey dashboards, a collaboration with the World Health Organization, the Johns Hopkins Center for Communication Programs, and Facebook's Data for Good initiative. Welcome to this interview, Dr. Dominick Shattuck. It is an honor and a pleasure to have you with us today.
So nice. Thank you so much for having me. It's my pleasure to be here.
Dr. Shattuck, you contributed to the first randomized trial focused on male engagement in reproductive health. Could you elaborate on the key outcomes of this study and discuss the potential benefits it may offer for both individuals and society?
To start off, let's kind of separate between male engagement and men's health, right? Because oftentimes when we engage men in these programs, the outcomes are usually women's focused outcomes, right? So we engage men to kind of work on some gender transformational aspects of their lives and the way they view health and their relationship with their partner, and to kind of try to develop a more equitable space for men and women in their relationship, versus men's health, where you're really focused on delivering services with the health services that they need. So in that project, we actually were able to randomize the treatment, which was an interpersonal relationship with a motivator in Malawi. And the men in the villages were able to kind of work with that man on a regular basis. Every few weeks he'd come by, have a little bit of information sharing, a little visioning, talking about the benefits of family planning and spacing and limiting family size. And what was great about that study was that we achieved our goal of increasing contraceptive uptake among the women in those homes in an equitable way. And what really kind of is most meaningful to me in that space is that women reported that their husbands were more engaging. They talked to them more often about like big issues and talking about challenges in their lives. And this was kind of a result of that transformational intervention in terms of like giving guys skills related to couples communication, talking about difficult situations, engaging one another and being together as a better couple. Other studies, we've implemented programs like that in Jharkhand, India. You saw men who participated in those interventions did things like spent more time with their children. They started to take on other child responsibilities around like cooking, cleaning, making sure the kid was ready to go to school in the morning. Even as, in my eyes, as critical as improving contraceptive use is improving that relationship within the household. So yeah, it was a really important study for that space. And now we're talking about how does that build out even further? And also kind of leveraging that for men's health outcomes as well.
That sounds fantastic. Now, as a co-chair of the male engagement section within the International Conference on Family Planning, could you share some of your key responsibilities in this role? Additionally, what emerging trends or innovations have you observed in family planning research?
From the momentum that came from the Malawi Male Motivators Project, the coordinators of the ICFP conference, for 1 year, they had a section that was focused on men's health and male engagement and men's reproductive health. Later on, they kind of blended that into a section that is more focused on gender. But in that role, I was helping to kind of like coordinate, put out calls for abstracts and kind of coordinate the sessions within the conference itself. Oftentimes when I give talks, I will ask the audience to tell me whether or not a doctor has ever talked to them about family planning. And you'll notice oftentimes that it's only the women who raise their hand. Very often doctors don't talk to men about contraception or preventing pregnancy or even proception. Only recently have we really started to look at the kind of the contribution that the quality of men's sperm have on the actual, the sustainability of their pregnancy, the health outcomes of the child and those other things. So I wouldn't say that it's as a result of the work around male engagement, but it provides a good kind of platform to start talking about men's reproductive health in general. I've also been involved in a number of different initiatives that are focused on male contraceptive methods, new novel male contraceptive methods that are being championed by a group called the Male Contraceptive Initiative, which is down in North Carolina. So I've been affiliated with that, and it's kind of spun out of that role with the ICFP and different projects and studies that I've implemented looking at men and their role in reproductive health. We also need to start thinking about what's the role of physicians in this space, right? So how do physicians start to engagement in a more meaningful way about their both contraceptive contribution, I guess it's a big way to think about it, but also like around just their health in general. And what does it mean to have healthy relationships, but also healthy, to have viable sperm that are healthy sperm. So in the proception space.
Great. So it's exciting to see how this work is focusing on men and not necessarily on women as we tend to do. Now, you have also contributed to a cohort study on a fertility tracking app and the development of the first mobile games focused on reproductive health. With digital health rights discussed at the 78th World Health Assembly in Geneva, Switzerland, how effective do you believe these digital tools and games are in advancing reproductive health education and outcomes?
Yeah, so I was a co-PI on a study that was focused on a digital app called the DOT app. And the DOT app, D-O-T, the DOT app was focused on, it was what they call a fertility tracker. It had a better algorithm, so they could potentially have a better refinement of when they were actually at threat of becoming pregnant with a partner. That digital tool was interesting because it opened my eyes to how people are interacting with their health and technology, right? From there, we started to think about what other types of tools could we implement and, within certain timeframes and budgetary limits. And we were able to spin into a game that we implemented in Nepal, which was called Nari Paila, which was based on, at that time, I was working in the space of what is called fertility awareness methods. And those fertility awareness methods are really kind of building off of the standard days method and understanding a woman's cycle, her fertility window, and finding ways to avoid pregnancy for women and for men, having them understand women's cycles better. But also within the games, we started to integrate other things around other contraceptive methods and around health and well-being for women and reproductive health. And one of the things that we learned from the games was that, it would be great if somebody kept an app on their phone forever. But the reality is is that we use the apps and they're somewhat disposable, right? So you have to start to think about like, what is the end outcome in terms of learning, and how many times does somebody have to play the game to get the information that you want them to retain? And we know that you need to kind of engage them continuously, and how do you kind of continue to do that? But right now I think digital space is very exciting. I think there's a lot of opportunities for novel ideas. I know that there are a number of different people who are getting into like the social media space, promoting reproductive health. We're starting to use that space more effectively. And now, figuring out how to do it and continue to do it and keep engagement high and, leveling up the education. And it's got to be coupled with information, from my previous work with male engagement. How are you delivering the content of reproductive health with the, kind of gender equitable, kind of transformative elements related to gender equity and, positive relationships and those types of things. So, we're trying to find that space in my work, and we're also trying to find it in some other projects, and hopefully we'll find ways for people to kind of engage more effectively and more consistently.
Right. Yeah. Digital space and social media space is kind of the new things. And as health providers, we need to be up to date with those opportunities too. Now, how has your research contributed to shaping healthcare guidelines on vasectomy? Additionally, according to you, what are some of the most common misconceptions about the procedure that should be addressed during patient counseling?
Yeah, so there are big community misconceptions around the vasectomy, right? So like I'll tell the story when we were working in Rwanda. I provided some help, but really there were some Rwandan people who really led the way, right? Leonard Kagabo was one of them. And we also worked with a physician from Canada, Michel Labrec, who was really outstanding trainer of those physicians. And, we would go from village to village every couple of days, and they would deliver the vasectomies. Leonard Kagabo would get on the radio and he would talk over the radio about, we're going to be providing vasectomies for free at this clinic. If you would like one in the next 48 hours, come to the clinic. And, he would be on that radio. He'd take SMS at the time. People would SMS in messages for him. And they were the typical messages like, so if you have a vasectomy, will you ever want to have sex again? If you have a vasectomy, will you get fat and lazy? If you have a vasectomy, will you not like your wife any longer? Our Dr. Kagabo did a great job of, speaking to them in language that was common to them, but also like, not being too technical about it, but, giving assurances. And I saw this firsthand one time when we had a session where we brought in all of the district's community health workers. And at the time I had just had a vasectomy back in the United States. I had come over back to Rwanda. I'm the big white person sitting in this room. And he's talking about vasectomy, and he has a big PowerPoint and he has the slides and the graphics and things. And I had a translator who was telling me what he was saying in Kenya, Rwanda about like, today we have someone in the room who has had a vasectomy recently. And he knew I had had a vasectomy. So I was thinking, he's going to tell them I'm the person and I'm going to be very embarrassed. And oh my goodness. And Leonard then, he says, the person is, please stand up. And he points to a man. He had planted a man, a vasectomy client. When this young man stood up, he was maybe 35. Every one of them in the room gasped. They went, oh my goodness. Like they could not believe that there was actually a Rwandan vasectomy client in the room. And the questions came, even from these health professionals, right? Even from them, they asked those same questions. Have you gained weight? Do you still want to have sex? He then looked over to his side and he asked his wife to stand up. And he said, this is my wife. You can ask her this question. And so it was amazing because the people in the audience actually clapped for her. They gave her the ovation. And then she told them, like our life is normal. It's just that I don't have to use hormonal contraceptives anymore. She told them the story. What I'm saying is that vasectomy provides an on-ramp for men to get into the health system, and even reproductive health. Just like women's reproductive health is a way in which the doctor can engage with them on a continuous basis, reproductive health can also be a way to pull men into the health system because they have other issues too. They have other diseases, they have other challenges that they're facing. And oftentimes men don't go because of cultural or, gender-based dynamics that are keeping them too proud to go and get help and receive help. I think on the back end of the vasectomy work too, is it really does kind of, when we ask those men why did you get the vasectomy? 50% of the men said they got the vasectomy because their partner was having challenges with hormonal methods. And so when you think about that, it tells us that they're having conversations about reproductive health with their partner. And two, it tells us that, these are guys who they're having the conversation, but they're also ready to enact something, to take on this responsibility, and to take on this responsibility that their wife may have been managing for 20, 30 years. You never know. And kind of finding ways to kind of message that and get that into communities is really essential.
Thank you for sharing that. Those questions coming from the community, those are real concerns for them. Dr. Dominick Shattuck, thank you for sharing your valuable insights on reproductive health and mental well-being. This conversation has been deeply informative, and we are confident that our audience will find your perspective equally enriching. Thank you.
Thank you.